Hello. Smile Trouble Consultation Room. This time, we will talk about autonomic nervous system imbalance. If you are watching this video or are around you, do you have an imbalance in your autonomic nervous system? Has anyone complained of having a headache, feeling dizzy or lightheaded, having palpitations, sweating a lot, or feeling anxious? The autonomic nervous system is a nervous system that adjusts itself unconsciously, so even if symptoms appear, we don't know the cause and tend to overlook them and think that they are just our imagination. So let's take a look at what the autonomic nervous system is. The autonomic nervous system unconsciously performs functions that maintain basic life activities such as circulation, breathing, temperature regulation, digestion, secretion, and excretion. The autonomic nervous system consists of the sympathetic nervous system and the parasympathetic nervous system. Sympathetic nerves are the nerves that work when we actively move our bodies, and become dominant during strenuous exercise or when we are excited or nervous. Parasympathetic nerves are the nerves that work when the body is at rest. It is dominant when you are relaxed, such as when you are sleeping or resting. Our physical and mental health is maintained because the sympathetic and parasympathetic nervous systems work together to maintain an overall balance. When the balance of the autonomic nervous system is disrupted, various symptoms called indeterminate complaints appear. Physical symptoms include headaches, dizziness, stiff shoulders, palpitations and shortness of breath, bright light, discomfort in the throat, hot flashes, lightheadedness, diarrhea and constipation, coldness, excessive sweating, fatigue, insomnia, and fatigue. Psychiatric symptoms include emotional instability, irritability, anxiety, and depression. If your symptoms are mild, it's easy to overlook it and think it's just your imagination, even though you're feeling a little unwell today. It is important to understand the autonomic nervous system and take measures before the symptoms worsen. When the balance of the autonomic nervous system is disrupted, a variety of symptoms appear, so if you try to see a doctor for each symptom, you may not know which department to go to. For physical symptoms such as headaches, go to a headache outpatient clinic or a neurologist. For dizziness or tinnitus, go to an otorhinolaryngologist. For palpitations, go to a cardiologist. For symptoms of glare from light, go to an ophthalmologist. For symptoms of diarrhea, go to a gastroenterologist. For symptoms of excessive sweating, go to a dermatologist. However, you may be told that there is no abnormality even after a medical examination. For psychiatric symptoms, patients will be referred to a psychiatry, psychosomatic medicine, or mental clinic. Therefore, as drug treatment, autonomic nerve regulators, tranquilizers, mild antidepressants, Chinese herbal medicines, hormones, and supplementary sleep-inducing drugs are used. Psychological treatments such as counseling may also be provided. If your symptoms do not improve even after being prescribed medicine at a hospital, receiving counseling, or taking self-care measures such as eating, sleeping, and exercising properly, you need to consider the real cause. The causes of autonomic nervous imbalance are generally thought to be irregular lifestyles, stress, and hormonal imbalance. I have met many people who are suffering from autonomic imbalance, and it is noticeable that many of them suffer from stiff shoulders. Therefore, by considering the relationship between the causes of stiff shoulders and the causes of autonomic imbalance, we will get closer to elucidating the true cause. One of the symptoms of autonomic nerve imbalance is stiff shoulders, and one of the symptoms of stiff shoulders is the same as various symptoms of autonomic nerve imbalance. Which comes first? Which is the cause? Or, it is important to focus on whether the symptoms of autonomic nervous system imbalance and stiff shoulders are occurring at the same time because of a certain cause. Therefore, it is important to learn about the functions of the hypothalamus, which is located in the diencephalon, the part of the brain surrounding the third ventricle in the brainstem, which is the center of the autonomic nervous system. The key to investigating the cause is the function of the hypothalamus. And it is caused by certain parts of the body that affect the function of the hypothalamus. It's the neck. The neck is a very important part of the body as it is filled with nerves. Self-care such as taking medicine, receiving counseling, eating, sleeping, and exercising properly is important, but people with autonomic nervous system disorder whose symptoms do not improve even after these measures should consider stiff shoulders. Learn about the mechanism and the function of the hypothalamus. Write down the severity of the symptoms, the parts that hurt, and the parts that feel strange that only you can understand. and not even the doctor at the hospital. Among them, it is important to pay attention to those who have neck pain or discomfort and those who have stiff shoulders. If you would like to know more about the neck, which is the real cause of autonomic nerve imbalance, information on how to relieve stiff shoulders, and information on neck treatments that improve autonomic nerve imbalance, please see the Smile consultation section in the summary section. Please click on the URL of the room's homepage. There is no consultation fee. Well then, thank you for watching the video.